Good morning, everyone. Myself is Rakhi Justin Sudha.
And myself is Anne Maria Jose.
So, we are today going to discuss about our capstone part 3. Our capstone topic is hospital-acquired infections. So, we are beginning with an introduction. Hospital-acquired infection, also known as nosocomial infection, is an infection that a patient occurs during the course of receiving the healthcare treatment in a hospital or other healthcare facilities. Why we chosen this topic is because hospital-acquired infection poses a significant threat to the patient safety and quality care. The chosen topic addresses a critical aspect of healthcare in Canada, aiming to enhance patient outcomes and improve the overall quality of healthcare services. So, the hospital-acquired infections Canada is a significant concern for the patient safety. And why it is become a Canadian healthcare issues. In Canada, hospital-acquired infections are a prevalent concern, affecting the health and well-being of patients. The Canadian healthcare system is committed to providing high-quality care, making the prevention and management of hospital-acquired infection as a priority. So there are some solutions to prevent the hospital-acquired infections. We can see that solution. First one is infection prevention education. We can give, as a staff member or the nurse leader, we can give education to the all other staff members, including a collaborating teamwork to reduce the hospital-acquired infection. Second is surveillance monitoring. In high authority or the nurse leader or the nurse manager can be monitor the performances of the staff to reduce the infection rate. And third is adherence to best practice. The all members can encourage the other members to provide the best or the antiseptic practice to the all between the all staff members. And fourth one is patient and family engagement. We can involve all the patient and the families to reduce as the hospital-acquired infection practices. And the last one is interprofessional collaboration. So in PDC cycle, we already see plan and do part. Now we are going to see the study part. After implementing all the prevention method, we can evaluate the outcome. How we are going to evaluate the outcome? This outcome we can evaluate first reduction in infection rate. We can check the infection rate, how much it has been reduced. By our aim was at least 5 to 10% reduced in 3 months. So the second is patient outcome and patient satisfaction. We can ask the client to how they are satisfied in these practices, how the infection rate are reduced. Third is the cost reduction. And the fourth one is education and the training effectiveness. Last is implementation of infection control practices. As we all know, when we are applying hospital-acquired infection, there are some barriers in between that. So we all should overcome these barriers. These barriers we can overcome by involves the some steps like implementing the staff training programs. Second is allocating the resource efficiently, and third is fostering a culture of continuous improvement. By these overcoming barriers, we can give the improve or the better quality of the care to or to prevent the hospital-acquired infection in between the clients. Thank you. Next is going to discuss by my team member Anne.
Sorry. So I'm continuing with the topic. As we all know that after implementing the preventive methods, there are some impacts for the staff members, leaderships, or patient and family. Mainly the staff members will experience an increased awareness and also the responsibility for the infection control. Leadership will help or need to drive the change and support for the staff members so that they are interrelated, and the patient or family members will benefit from a safer healthcare settings or healthcare environment, and that leading to an improved healthcare outcomes. These are the main impact. Then we have already seen the PDSA cycles plan, do, study. Then we are going to deal with the act in the PDSA cycle. We can act this by giving proper continuous education and through regular audits, and also to adapting to evolving infection control practices. Next is the leadership support and style. We have chosen the transformational leadership style. That means there are some of the key points for the transformation leadership style for our scenario. That is visionary approach, inspiration and motivation, individualized consideration and adaptability. The leadership support is crucial, and the transformation leadership is an important type of leadership style that will motivate the staff members to give a proper care to the clients for, and also they are working for a common goal. And leaders need to foster support and culture of openness for the change, and also there should be a support ongoing education and recognize them and reward adherence to infection and control practices. Next is the resources for the change. There are some of the resources for the change to reduce the hospital acquired infections among the hospital settings. Some of them are financial support, training facilities, collaboration, engaging external stakeholders, forming partnerships. That means these all can provide the additional resources and expertise for reducing the hospital acquired infections. The training facilities means there should be needed for the staff members for needed a main training for the hospital acquired infections to reduce. Then there should be financial support. Collaboration is an important thing. There's communication and collaboration plays an important role in the reducing the hospital acquired infections among the healthcare settings. So these all are our topic. For in conclusion, means we can address our hospital acquired infections in Canadian healthcare. It's a multi-phase process that involves studying our current practices, implementing some of the solutions, establishing susceptibility through effective leadership styles, and so continuous evaluation and adaptation will be crucial to achieving and maintaining improved outcomes over the long term. So these are the references we have chosen in the scenario. So thank you so much.